Welcome back. Looking your best this summer is no sweat thanks to the latest advancements in skincare treatments. Dr. Patrick Carney of the Skin Speak Spa, MD, is here with more on some non-invasive procedures. Hi, Dr. Carney.
Good morning, Corbin.
And we're going to solve perspiration as well as many other things that I think people are very interested in right now about their skin. Before we get to that, let's talk about you just a minute, because for 6 years in a row, Minneapolis St. Paul Magazine picked you as the top doc in this category. And I know also that you're the Midwest's leading provider of these types of services.
Yes, we've been very fortunate to be successful with Botox Cosmetic and now Botox Therapeutic. Even though they're the same product, there's a different indication, whereas Botox Therapeutic is indicated for hyperhidrosis, which is a fancy name for excess sweating.
Okay.
And the FDA has approved Botox for underarm sweating, as well as it can be used for palms and soles, where it can stop sweating for up to 6 to 9 months. So it's an incredible treatment for people who suffer with excessive perspiration.
Now, how many treatments does someone come in and get for something like that?
It's difficult to determine exactly how long it will last, but most patients are treated twice a year. Mm-hmm. And insurance companies are covering it about 100%, so it's really fantastic for patients.
Really? Have you had this treatment done?
I have, actually. Do you notice? Completely dry.
Even on television?
That's right.
Well, it's good, though. It's good because you understand how this works and how this feels and how it ends up working out for you. Let's talk about the cosmetic Botox, because that was the therapeutic. And then the different indications for the use of cosmetic Botox is?
Yes. Well, the FDA has also approved Botox Cosmetic for the furrows in between the brows.
And I think most of us are familiar with that.
Yes, and it's also used along the horizontal lines in the forehead and the laugh lines around the eyes. Mm-hmm. And I'm also not ashamed to admit to you and the rest of the listeners that I've had it there as well. So you can see that I still have, I believe, a very natural appearance in my forehead and my eyes, but yet I'm not able to crease my forehead and develop
in the deep furrows.
The deep furrows between my brows, if they wanted to zoom in on.
Now, this is a little commercial here that's been running, and I have seen this, and basically it's the idea that if you use this cosmetic Botox, you still have lots of expression, because that's been one of the concerns in the past.
That is correct, and I think in the past, maybe initially when Botox was approved, that some of the injectors were putting too many units in, giving you kind of a frozen appearance, but we've been trying to use fewer units, which is good for the patients because it's less cost, and they like having more expression as well.
Right, and you were actually winking at me out there in the
That's
hallway,
right.
So I know your wink works. Now, there's something else called dermal fillers, and there are a couple of types of those, and we want to walk through those for our viewers. Should we start with Juvaderm?
Well, before we do, I should probably mention the first one that was approved was collagen.
Okay.
And that was 20 years ago. Collagen was the first filler approved, but since then we've had many different fillers, including Juvaderm, which is the newest hyaluronic acid filler. Restylane was the first hyaluronic acid, but Juvaderm, which is also made by the company that makes Botox. In fact, you can see it being injected right here into the nasolabial fold, which is a very common place for the product to be injected. And one of the differences in Juvaderm is it lasts longer than Restylane. It's got more hyaluronic acid, more cross-linking, and we think that the product could last up to 17 months, which is really a big breakthrough for dermal fillers.
Now, how does that compare to Artifill?
Well, I'm glad you asked. Artifill, in fact, here's some pictures we ought to take a look at. Here's a before and after picture of the lips. And collagen or Cosmoplast was used to define the vermilion border, which is the outline of the lip. And the belly or meat of the lip was injected with Juvaderm, which is a hyaluronic acid. So the HAs are used for volume, and in this case, the collagen was used for structure to define the lip border.
Okay, now we're going to look at some Artifill.
Yes,
photos, I believe. Yeah. Tell us about Artifill.
Artifill was approved. Well, here's the photos. I've got to just tell you how remarkable this is. A woman who had Artifill injected into the relatively deep nasolabial fold, And there's a before picture on the left, and the after picture up to 1 year shows complete correction and no loss of correction. And this filler is actually considered to be permanent. They have studies to show that it lasts up to 5 years, but it's got a permanent component called polymethylmethacrylate, which is a medical grade plastic. In this gentleman, you can see also a complete correction of that nasolabial fold. The after shot is 1 year, but I've been told this is actually a 5-year photo. So this patient was able to maintain a complete correction for up to 5 years.
Now, if people want to get in on this and find out more about it, you have an upcoming event. Tell us a little bit about what's going on there, because I'll give them all the particulars.
Okay. Wednesday of this week, we're doing an event down at our Skin Speak Spa MD, where we're doing live patient demonstrations as well as complimentary skin tests for Artifill.
Right, okay, well, I'm going to tell everybody how to get in on it. Thank you for coming by today, giving us all this information. Skin Speak Spa MD is holding a dermal filler event focusing on Juvaderm and Artifill this Wednesday at 6 p.m. Admission is free, but you must register for the event. There will be special treatment offers, patient demonstrations, and complimentary Artifill skin tests. To register for the event or to get more information on other services offered, call 952-435-6565 or go online to skinspeaks.com.